On behalf of the theatre team, I'll speak on behalf of the theatre team. It was very, very well organized compared to the Moyale team. I found the Marsabit team a bit more organized. We had several nurses in theatre, and they were very, very well psyched for us to operate. When we started, we had one nurse who has already been trained in ophthalmology, but she had not done surgeries for a while. But by the time we were doing the second case and the third case, she had already caught up. So like you say, I think the only thing that we need to do is just do a little bit of mentorship, because you have a very good microscope, which I used to operate with. You have a very nice theater. You have a very well-equipped eye unit, which is not common in most government hospitals. So I think the only thing that is lacking is just a little bit of mentorship, just that. And then I know you can run this eye clinic better than it is right now, because right now it's not running at 100%. I'll give it about 50%. But I know it can do even better than that. With people like Faith with you, who are very, very dedicated staff, I think you can go very far. So again, rating. Out of 10, I will give you a 9. Yes. I'll give you a 9. Yes. I'm not very generous, but you're doing very well.
Albert has talked about the inside of the theatre. I'll talk about the outside. The arrangements were quite good. We got the support from the Faith and the other doctor, and Dr. Riban was also there to support us. The few challenges we got, we were able to sort them out, because I think with the screening area, we wanted to separate from the screening area and the surgical area, which we did, which was quite okay. Other places you go and find people are a bit resistant. They want, if it's eye, you work from the eye clinic, they don't want to change. So we were very appreciative. And as Albert has said, that's a challenge we had in Moyale, because Moyale, they were not willing to move from their unit to do the screening. They wanted to do it from the room. And here we moved even to, I think, to the OPD for the screening, which was quite good, because now we were able to separate the patient. We only bring the ones who are coming for surgery. On the other side, the only thing I would recommend, and as we said also in Moyale, next time maybe, with your permission, the first day, let the publicity start maybe 2, 3, 4 weeks before the camp, so that at least more people can know. Because when we do it like we did this time, maybe in a week or less, we found that people who were booked, as Karugara saying, we were able to operate on them, but we would have booked more if we did more publicity. But I think from your office, and because I was seeing from the social media, it was quite good. So the only challenge was about the short notice, but I think it was also from our side. I think there was that lapse of maybe agreeing about the camp and all that, which now maybe in the future we need to agree that. Albert has talked about mentorship. I'm also the one in charge of training at Rounds Hospital. Maybe, Doctor, you can maybe nominate one of the persons, maybe not Faith, because Faith is a different field. I think you have a cataract surgeon who can come maybe for a 6 weeks course, so that at least they get them. Because the hands-on, because after training, if you don't practice for some time, then you become rusty, as we say. And we have that. And for us, the beauty about Rounds, the numbers, you have the numbers. Anytime you come, because if a training was to come, they have to do 40 cases, which within 6 weeks they are able to do. As the numbers we have done here, one surgeon is supposed to do that so that we qualify them. So we agree with you. I'll give you the contacts. Then I send the forms. You can nominate someone. Then we look at the formalities of maybe the cost and all that, who meets what and who meets the other. On a scale of 1 to 10, I'll give you a 6. Because of the issues I've raised. Why I'm giving a 6 is at least so that we have room for improvement. Albert has given you a 9. You might say you only need to do 1 to get 10. For me, I want us we do at least about 4 times. Like we have seen the training, the publicity, then maybe 2 other issues which maybe I can discuss with Dr. Riban.
6 is above average, so we appreciate that.
And at Charity Vision, our main mission is to help prevent treatable blindness. And we do this by provision of cataract surgery consumables, and also in some occasions some reading glasses, and also prescription glasses. And I must say that being here has been quite an eye-opener for me, because Northeastern Province has been one of the places that we have wanted to visit as Charity Vision, and look for partners who we can give the consumables to be able to perform their duties effectively. So with that, maybe after this we can have a discussion with the ones who are concerned with it, and we can have a donation sent to you probably in the next month or two, so that you can be able to continue your work. Thank you.
Mine is word of appreciation. I want to first appreciate the First Lady of Marsabit County. Mama Guyo, you know, sometimes I say, I try to look at my staff establishment, and I try to find your name. You are more than a stakeholder. You are a member here. So we really appreciate your support always, and thank you so much, and may God bless you. For Package team and the Lions, you know, it is very hard to tell who is from Lion and Package. This is a very seamless team, a very cohesive one. Mama Guyo, this is a very good team. I want to appreciate them in a very special way. You know, after the first day, around midday, it was not easy even to tell who is from here and who is visiting doctors. Very fast, people merge, people integrate, very cohesive one. So hata ile mambo ya watu wanasema, we want a visiting doctor, hakuna. They are very accommodative, and kutuonyesha they are specialists coming from Nairobi, ni watu wa Kenya V. So we really appreciated that. Thank you so much. Before they came, we were able to screen a good number, around 95, before day one was identified of cataracts. Of course, it is at the prerogative of the surgeon to say this one fits surgery or not, but from our end, we were able to identify around 95. When they came in, we continued together with them with the screening. We managed to do around 170 identified. That is at the screening point. So I am very sure this team wangefanya even more than that if we were not interrupted. I wanted us to do this one very perfectly without any excuse. So whatever happened was beyond our control. Mama Guyo, when it happened, I thought they would run away immediately. So I was standing here assuring them. So most of them are even more confident than me when I say, hii tumezoea. I never expected that from them. So nawashukuru sana. One last thing, I really appreciate you people. One last thing, I don't want this to end here. We need to continue. If you look around this hospital, my staff knows the high clinic is the thing that I have focused last, so that I want to give my attention. Our first meeting, I have done meeting with all others, starting with the maternity, dental, renal. If any visitor comes, say, I want to go to maternity, I'm not worried, because we have done our interventions there. Dental, if you come today, we give all the service, like any other public hospital. High tumeanza tu juzi, because we had some challenges, especially with staff establishment, but we have just started. So for us, this one is a godsend. It will give us more hope. Faith she's in charge of that unit. In fact, literally before Faith, there was no even in charge. So we have already started, and this one has boosted us. I have already shared with Peter. We have now known that there is a need for this service. Mama Guyo, I want to assure you, as a CEO of this hospital, the people, now that we know there's need, we will not stop here. We will liaise with these able partners to get through your office and do something.
You know, as Lions, I know it's a big hospital. It has many donors and many people come. Team Pankaj also is a big organization that can also help us on something. The first ask for me is if there is any partner who can do for us a model clinic like the one in Marsabit, in Moyale, it would serve us. So we look at, you know, there you are in the normal theater. That is where you could interrupt you when we had the emergency. So how can we have a model clinic in Moyale and other parts of the county also? If you can have that for us, it will be good. The other one is that exchange program, or you know, partnership has been put forward by Peter, so that you know, we can have continuous training every time, so that our people can come there, you guys can come here and see, and even, you know, complex surgeries that you may think it can only be done in Nairobi. One day when it's done around here and our people are able to see, then that will be good. I remember in Moyale you mentioned about kids, and you said that they needed specialized equipment. How can we help the Marsabit Referral Hospital to be able to handle children cases? That is something you could be looking at. In terms of consumables also, thank you, Team Charity Vision, for the offer. You know, devolution came and, you know, health was devolved. But just like national government and all those things, there are challenges that each government has, including for us now who, you know, get our medicine from KEMSA, you know, the way money is trickling to the county government, and of course generally the economy the way it is. You remember when we came in first, Peter, we discussed about medicine, and we had said that medicine will be free for the camp, including the surgeries. But when in Moyale you guys came in and there was even a mention that the medicines are going to be charged, it was almost going to FM, that Mama said it's a free camp and she's now charging, with the political connotation, you know. So we had really to step in and say, oh no, this one, we will do housekeeping somewhere. Let's stop it at this. This is how our people are, you know. You know, there is, it's not that they don't want to pay that money. They don't have. They don't have. So 100 bob, which may be a lot to someone who feels like you're giving somebody a service that could cost. The surgery is how much? Normally 100 to 130? Yeah. That's what it costs in Nairobi, right? So you can look at it from the perspective that, you know, this person, I'm giving a service that is costing him or her 130,000. Si anunue dawa ya 300. I think that is the perspective someone is looking at. Lakini hana, you know, because if my vision, what is between me and light, that has made, like in Moyale, this old mama who hasn't seen her kid for 4 years, and she saw the baby for the first time that time, and you see 100,000. If she really had, she had gone through that, yeah? So that's why we are very particular when we tell people that this is a free camp and this is what is happening. That's why we had to come in very fast. But I thank you guys for understanding and, you know, stepping in also. So how can we have a model clinic there, and how can we improve on the services that are here? Where we are seated right now is our cancer screening clinic. It was built in partnership with not built actually, it's a building that was renovated in partnership with a team from Nairobi who partnered with our office as County First Ladies, and we were able to give this service. As we speak, this clinic has most of the equipment that are needed to screen for cervical cancer and breast cancer, and they are able to treat early stages, because that partnership helped us to get the equipment, to get the training, and also there is a team that even offered us telemedicine. They brought in a laptop and we can speak to Eldoret Referral Hospital. That is a kind of partnership we'd want for our eye unit, and that will leave a mark even after Mama Guyo has gone to to serve other duties. So that partnership also, how can we get it, the training, and then the patients that have been left out of this clinic this time round. I must say that we need a discussion around that. These people have already been booked, we have their contacts, but unfortunately this happened. So for me, the ask also would be, how can we have these people together and how can we have you back, even if only for them, so that they feel like they were part of this camp. So this is a discussion. You may not make a decision now, but when you go, I'm sure Liban has the list. How do we give them the service so that as they remember about what happened on the way to Badassa, that made them not to have that service, somebody somewhere had already catered for them. So how can we, maybe even if it's a discussion we can have, you coming back and doing it. I thank you very much, really, that even today you umejitolea, and it could have, the camp would have ended yesterday midnight, but even today you are able to come and checking on, and I can see your team is already there. Actually, we are taking much of your time. And I also want to welcome you back again anytime. I really appreciate you guys, and I really thank you from the bottom of my heart. The governor would have joined us yesterday. That is when he was to come in and have a word with you. Then whatever happened, happened. But on behalf of him and the government, I think you are, throughout you are with our CEC, Dr. Jama, our CEO, Grace Galmo. They all really appreciate the service you have given us. And I know you are in the field of medicine. Anything you feel like requires, that is in, we say in Nairobi, that can be brought to Mashinani, we will be very grateful. And indeed, thank you so much. May God bless you.